Deputy Speaker. I still remember visiting Fairfield Hospital back in 2019 and was really shocked to learn that the hospital, the doctors and nurses were still using clipboards, writing patients' details by hand. Why? Because the answer was they had no Wi-Fi, no electronic records. The hospital didn't have enough electricity capacity load to support it. I couldn't believe it. In modern Australia, our frontline health workers were relying on pen and paper. I fought for change, and today Fairfield Hospital is better with upgraded technology that helps doctors and nurses care for patients more efficiently. But the truth is, we still have a long way to go. Fairfield Hospital still don't have an MRI machine. Patients are still being sent to Liverpool Hospital, which is already overcrowded. And our hand clinic, one of the only ones serving not just Western Sydney, but the entire Pacific region, is operating on a demountable, a temporary structure for critical healthcare service. The New South Wales Labor government promised $500 million for Fairfield Hospital in 2023. But instead of funding urgently needed improvements, most of that money is going towards yet another master plan. Our community doesn't need a master plan. We need action. Then there's Medicare. When Medicare was introduced in the 1980s, it was groundbreaking. It meant Australians could see a doctor without worrying about costs. But today, it's broken. Doctors are struggling to keep their clinics open. Patients are struggling to afford a visit. Here's the reality. Bulk billing rates in New South Wales have dropped to 37.2%. The average out-of-pocket fee is now about $42.44, and 37% of doctors are charging over $90 for a 20-minute consultation. But there's something we don't talk enough about. A doctor's consultation isn't always 10 minutes. Medical science has advanced. We now understand complex diseases that take time to diagnose. And in a community like Fowler, a doctor's visit isn't just about symptoms, it's about trust. Patients don't walk in and immediately list their symptoms. They talk about family, mental health struggles, gambling addiction, financial stresses, because that's how they build their trust with their doctor. Yet under the current Medicare system, doctors are forced to rush through consultations, financially penalising if they spend more than 10 minutes with a patient. The cost of inaction. For many families in Fowler, $42.44 could contribute to their groceries, which we know has increased dramatically, but many are prepared to skip a doctor's visit. They wait until it's too late. And then they end up in emergency, putting even more pressure on our already overwhelmed hospitals. Dr. Seng Lim, another Western Sydney GP, has started using remote monitoring to keep patients out of hospitals. It's innovative, it's effective, and yet Medicare doesn't cover it. Why? Why are we forcing families to choose between their health and their next meal? Why are we ignoring solutions that could prevent hospital overcrowding? The government talks about increasing Medicare rebates, but let's be clear, those increases only apply to children under 16 and those on healthcare card holders. What about middle Australians? How do they cope with the rising cost of living and high healthcare costs? So I call on the Anthony Albanese government to take real action. Increase Medicare rebates for GPs. The Royal Australian College of GPs has called for a 20% rebate increase for longer consultations. Incentivise doctors to work in communities like Fowler, just like regional doctors receive extra support. We need a similar tier for GPs in lower socioeconomic areas. This will help retain doctors, so families don't have to wait to travel to wait for care. Invest in preventative care. Medicare should cover remote monitoring and community health programs, keeping people healthier and reducing hospital strain. Because healthcare should not be a privilege, it should be a priority. I don't want to hear another story about a mother who can't afford to take her child to the doctor. I don't want to hear about another GP closing their doors because they can't afford to stay open. And I certainly don't want to hear about another government spending money on plans instead of fixing real problems. We need action now, because no one should suffer just because they can't afford a doctor. Thank you, Deputy.